Good afternoon, student. Good afternoon. Are you there?
Good afternoon, ma'am.
Afternoon, ma'am.
Good afternoon. Only 2 students are listening. Am I teaching 2 students?
Good afternoon, ma'am.
Good afternoon. So today we'll study the remaining part of the rib in rib 2. Is the slide visible, student?
Yes, ma'am.
Only one student?
Yes, ma'am.
Yes,
Yes,
Okay.
ma'am. Visible.
Okay, now today we will study the remaining part of the typical rib followed by atypical rib. Okay. So in the previous class we have finished up to the posterior end, vertebral end, anterior end, sternal end of the typical rib. Now today we'll do the shaft of the typical rib. This is the shaft of the typical rib. The shaft of the typical rib is, here you can see it is thin. Okay, it is thin and it is flat and it is curved. Now what is the direction of the shaft? Here there is a tubercle. From the tubercle you can see the direction of the shaft is directed backward and laterally. See, it is directed backward and laterally. Then there is a sudden swift turning forward. Okay, and a point where there is a turning of the rib from backward and laterally to downward and forward. This turning point is known as angle of the rib. This is known as angle of the rib. The site of changes is known as angle of the rib. And this is the weakest part of the rib. Okay. Now, my dear student, since there is a twisting of the rib in the angle of the rib, so the two end, that is, this is the which end? This is the vertebral end. This is the which end? Sternal end. Do not touches the horizontal plane. When you put the, see here, when you put the rib in the horizontal place, can you see the rib? I am putting the rib in the flat surface. See, you can see that anterior end touches the surface, but posterior end is elevated. Are you able to see?
Ma'am, can you please keep your hand a little bit upward?
Can you see now?
Yes, ma'am. Thank you.
Yes. Now can you see the posterior end is little higher above, and the anterior end external end touches this book. So because of the twisting, the two end of the rib cannot touch the horizontal plane. Only one end touches the horizontal plane. Okay. Now here you can see this is in the rib from the tubercle. This is the point of the tubercle. It is directed backward and laterally here. Backward and laterally. As it is directed backward and laterally, it forms area. See, this much area. In both sides, the rib are directed backward and laterally from the tubercle of the rib, so that it forms an area on which the individual, one can lie on its back when you are sleeping. So find comfortable on lying on one's own back. Okay. So if suppose in the case of the animal, if you have noticed, the direction of the rib is from the tubercle of the rib only, it is directed downward and forward. There is no direction to backward and laterally. Okay. So it is quite difficult for them to lie on their back. They will roll on the side. If they lie on their back, they will roll on their side. But in the case of the human being, what happens? the direction of the shaft of the rib from the tubercle, first it is directed backward and laterally, then there is a twisting takes place at the angle of the rib and it is directed downward and forward. So since the part of the rib which is directed backward and laterally provide an area on the back on which one find comfortable to lie on its back. Okay, so this is the concept here. Now, because of this, on the inner aspect, by the side of the vertebra, on the inner aspect you can see on the both side of the vertebra, there will be formation of the gutter. This gutter is known as paravertebral gutter for the accommodation of posterior border of lung, right and left lung. So this is the importance, functional importance of the direction of the shaft of the rib from the tubercle to the angle. What is the direction? How does it directed? It is directed backward and laterally. Okay, such that it forms the paravertebral gutter inside the thoracic cavity on which the posterior border of the lung rests. And posteriorly, because of this direction, it provides the area, sufficient area on which the individual find comfortable to lie on the back or to sleep on the back. In which position? In recumbent position. Okay. Now another is, what are the parts of the shaft of the typical ribs? The part of the shaft of the typical ribs are, it has two surfaces. This is outer surface and from inside this is inner surface. Which surface? Inner surface. It has two border. This border which is seen from above, this is upper border. The border seen from below, this is sharp border, this is lower border. This is which border? Lower border. This is which border? Round blunt border. This is upper border. Okay, it has two angle. This is the posterior angle. Okay, posterior angle, and here is the anterior angle. Okay. Now the superior border of the shaft. This is which border? You can see this is which border? Superior border. This is which border? Superior border. The superior border of the shaft is thick and rounded. It is blunt. So it has three parts. Okay, it has three parts. This is inner lip. This is intermediate area. And here this is which lip? Outer lip. Outer lip. This outer lip, here you can see, this outer lip give insertion to this muscle. Which muscle is this? External intercostal. The intermediate area give insertion to this muscle. Which muscle is this? Internal intercostal. Internal intercostal. The innermost lip, here you can see, the innermost lip give insertion to this muscle. Which muscle? Innermost intercostal muscle. Okay, again I repeat, superior border has three lip, outer lip, superior border has three part, that are outer lip, intermediate area and inner lip. Outer lip provide insertion to this muscle, external intercostal muscle, here, external intercostal muscle. Intermediate area, this is intermediate area, provide insertion to this muscle. Which muscle is this? Internal intercostal muscle. Internal intercostal muscle. Inner lip, this innermost lip provide insertion to this muscle. Which muscle is this? This is innermost intercostal muscle. Okay. Now the lower border. Here you can see the lower border is very thin and it is very sharp. The lower border forms the lower margin of which groove is this? See this, there is a groove on the inner aspect of the rib. This groove is known as costal groove. Costal groove. So the lower border form the lower margin of the costal groove and this provide origin of this muscle here. See, origin of this muscle. Which muscle? Origin of external intercostal muscle. External intercostal muscle. Outer surface. This is which surface, my dear student? This is outer surface. Outer surface is also known as external surface. It is also known as external surface. Outer surface is smooth and convex. Convex. Outer surface has on the posterior part there is a ridge. This ridge, which is directed downward and laterally. And this ridge provide in attachment to this fascia. What is the name of this fascia? From thorax to lumbar region, thoracolumbar fascia, and the muscle of the erector spinae, part of erector spinae, iliocostalis thoracis. Iliocostalis thoracis. This is about outer surface of typical rib. Now, in the outer surface, it has two angles. This angle here is known as the posterior angle, or also known as angle of rib. Okay, the posterior angle, and there it is seen as a ridge. The distance between, this is the tubercle. This is the tubercle. The distance between tubercle of the rib and the angle of the rib. Which angle? Posterior angle of the rib increases from 2nd to 10th rib. And the maximum distance is how many centimeter? 5 centimeter. In this area, there is attachment of two important muscles. This muscle is known as levator costae. Levator costae. And this muscle here, this is the big muscle which produce the erection of the vertebral column. Okay, which produce extension of the vertebral column. This muscle is known as erector spinae. Erector spinae. What is this? Erector spinae. Okay. Then, as I said earlier, there's two angle, that is posterior angle. Posterior angle of the rib is also known as angle of the rib. And there is a slight angulation anteriorly here. The slight angulation here, it is known as anterior angle. Anterior angle. Anterior angle is about, this is external end. Yes, this is which end, my dear student? External end. It is about 2 centimeter behind the external end. Okay, 2 centimeter behind the external end. And there is the presence of ill distinct oblique line. This ill distinct oblique line. This ill distinct oblique line separates the attachment of, my dear student, here you can see, separates the here ill distinct oblique line, separates the attachment of external oblique muscle of anterior wall of abdomen. This is external oblique muscle of anterior wall of abdomen with serratus anterior in upper 8 ribs. And this is which muscle? This one is latissimus dorsi. Latissimus dorsi. Serratus anterior in upper 8 ribs and latissimus dorsi in lower 3 or 4 ribs. Okay. So that means there is an interdigitation of external oblique of anterior wall of abdomen with the serratus anterior and latissimus dorsi muscles of upper limb in the anterior angle of ribs. Now, the another surface is internal surface. This is which surface? Internal surface. Internal surface is also known as inner surface. It is smooth and it is concave. Concave. What is the feature here? On the inner surface, near the lower part, there is a presence of the groove. What is the name of this groove? Costal groove. Costal groove. The costal groove lies near the lower border on the inner surface of the rib. The costal groove has upper lip. This is upper lip. Upper lip provide origin of innermost intercostal muscle. Here you can see innermost intercostal muscle. Then it has floor. This is floor. This is floor. Okay. The floor provide origin to internal intercostal muscle. Between the innermost and internal intercostal muscle lies the neurovascular plane, where lies the intercostal vessel and nerve. The arrangement of intercostal vessel and nerve from superior to inferior are: first vein, intercostal vein, below vein lies intercostal artery, below artery lies intercostal nerve in the costal groove. Which groove is this? Costal groove. What is the arrangement? Van arrangement from superior to inferior. B stand for intercostal vein, A stand for intercostal artery, N stand for intercostal nerve. Then it has lower lip. This is the lower lip. The lower lip of the costal groove is the lower border of the rib, and it provides origin to which muscle? Outermost muscle. Which muscle? External intercostal muscle. Okay. So tell me, my dear student, where does the costal groove lies in the rib?
In the inner surface.
Lower border.
In the inner surface near the lower border. Very good. What are the part of the costal groove in the typical rib?
Upper lip, floor and lower lip.
Very good. Upper lip provide origin to which muscle? Which muscle is this?
Innermost intercostal muscle.
Yes. On the floor, there lies the neurovascular bundle. What is the orientation of neurovascular bundle in costal groove?
Intercostal vein, intercostal artery, and intercostal nerve from superior to inferior.
Very good. Van arrangement from superior to inferior. If you remember in femoral triangle also van arrangement, but it is from medial to lateral. Yes or no, my dear student? But in the intercostal groove also, it is in the van arrangement. But what is the orientation? Superior to inferior. Clear? Do you remember femoral triangle?
Yes, ma'am.
And in the triangle also, the arrangement of the neurovascular bundle is from medial to lateral, it is van. But in the costal groove, it is also van arrangement, but how it is oriented? Is it medial to lateral?
No, ma'am.
It is from superior to
Inferior.
Very good. Superior to inferior. Okay. This is a very important question. Now, we have finished the part of the typical rib. Now we should know the side determination. See, I am holding the bone. Hold the bone in such a manner, this posterior end should lie behind, directed posteriorly and slightly higher level. The anterior end should lie in front, slightly below. The concave inner surface should face medially. The convex outer surface should face laterally, and the sharp lower border directed downward. Now this is how you can determine the side determination of the rib. This is of which side of typical rib? This is of right side. This is of which side? Right side. When you come back to the college, we will again teach you face to face. But right now when you are in home, please study these with the help of your book and atlas. And if you have any queries, you can ask me. Okay, this is very important. Now we will go to the atypical rib. We have finished the typical ribs. Now we will go to the atypical ribs. Atypical ribs are first rib, second rib, 10th rib, 11th rib and 12th rib. First we will start with the first rib. Here you can see the first rib is strongest and it is flattest and it is most curved of all true ribs. Okay, and it is one of the shortest of all true ribs. What is the direction here? It is directed downward and forward. My dear students, see carefully here. This is very, very important. The sternal end lies about 3 to 4 centimeter below the, which end is this? Vertebral end. This is vertebral end. This is sternal end. In such a manner, here you can see this is the apex of the lung. The apex of the lung covered by the pleura, okay, lies above the sternal end but do not extend beyond the vertebral end. This is the vertebral end. This is the vertebral end. Do not extend beyond the vertebral end. Okay, this is very important. What do you say? Viva question, osteology Viva question. Most of the time, your examiner, external examiner, will ask you what is the relation of the apex of the lung with the first rib. What is the relation here? You should know the sternal end of the first rib is directed downward and forward. It is slope. It is about 3 to 4 centimeter below the vertebral end, such that the apex of the lung covered by its pleura will extend above the sternal end but do not extend beyond the vertebral end. This is what you should say in the Viva answer. Now, parts. The parts of the any rib, you know that it has the anterior end, sternal end, posterior end known as vertebral end and a shaft. Similarly, the first rib also consists of the anterior end. This is the anterior end also known as the sternal end. It is larger and thicker. It joins with the manubrium, widest part of the manubrium. Okay, and the joint name is first chondrosternal joint. What is the type and subtype? The type is cartilaginous, subtype is primary cartilaginous, and it is replaced by bone after 25 years of age. However, the age may vary, slightly vary, depends upon the individual. Okay, this is about the sternal end. Now the posterior end. This whole end, what is the name of this end? Posterior end. The posterior end is also known as vertebral end. Okay, and the vertebral end has 3 parts. What is the first part, my dear student? This is the head. Head. Now, head is small and rounded. Head has a small articular facet which articulate with, here you can see, articulate with the side of the body of first thoracic vertebra to form first costovertebral joint. Costovertebral joint. Okay. Then neck. This is the neck of the first rib. The neck of the first rib is rounded and elongated. What is the direction? Very important here. It is directed posterolaterally with upward inclination towards the tubercle of the rib. Okay, that means it is directed backward, upward and laterally. Now the relation is very important in the exam, spotter exam, in the 3 marks question or 5 marks question. Most of the time we ask this every time in university exam. Identify the marked area of the bone, that is the neck of the first rib. Mention the relation, anterior relation in order. So the neck of the first rib has anterior surface, posterior surface. The anterior surface has few structure related, very, very important for a spotter. They are from medial to lateral, they are sympathetic trunk, first posterior intercostal vein, superior intercostal artery, and ascending branch of the ventral ramus of first thoracic spinal nerve. Ascending branch of ventral ramus of first thoracic spinal nerve. How many structure? 4 structure. This is a very important diagram that we ask most of the time in SAQ. Also draw a well-level diagram showing the relation of the first rib. Okay. Then what is the another third part of the vertebral end? The third part is the tubercle of the rib. The tubercle of the rib is broad and prominent, and it is directed upward, backward, and medially. It has an oval facet here, oval facet, which articulate with the transverse process of the first thoracic vertebra to form the first costotransverse joint. Now, coinciding with the tubercle of the rib, there is the angle of the rib. The angle of the first rib coincide with the tubercle of the rib. Coincide with the tubercle of the rib. Okay. Okay. So, what are the part of the vertebral end of the first rib, my dear student?
Head, tubercle, and neck.
Head, neck, and tubercle. Okay.
Yeah, yes, ma'am.
Okay. Now, can you enumerate the relation of neck in order?
Ma'am, anterior surface
Yes,
of the neck.
that is yes.
It has sympathetic trunk, first
Yes.
posterior intercostal vein, superior intercostal artery, and ascending branch of ventral ramus of first thoracic nerve.
Okay. So these are the 4 structures. Can you write down this in the spotter exam if we ask you?
Yes, ma'am.
All of you?
Yes, ma'am.
Every time in spotter this question is there in university and semester. This time practical exam was not there, only theory over. But you are first MBBS university going batch. So in university exam, if they say we have to, if suppose we have to take online, then we'll use the identify the arrowed area of the bone, mention its anterior relation in order. So you have to enumerate these 4 structure in order. In order means from what order? Medial to lateral.
Medial to lateral.
Okay, all of you can do it. All 100 student. Yes?
Yes, ma'am.
Okay. Now, what is the posterior end finished? Now what comes? Shaft. What is this? What is this part? Shaft of the first rib. The shaft of the first rib, in the case of the typical rib, shaft is curved. Okay, but in the case of the first rib, it is flat. And it has 2 surfaces. This surface that you are seeing here in the picture is the upper surface. Okay, and here not shown. I didn't find the picture. Below is the lower surface. Okay, it is not seen in this picture, and it has 2 borders. In the typical rib, what are the border? Upper border and lower border. But in the first rib, it is outer border, and this is inner border. Inner border. What are the border in the typical rib, my dear student?
Upper border and lower border.
But in first rib, is it upper and lower?
No, ma'am.
No, ma'am.
It is
Outer border and inner border.
Outer border and inner border.
very good. In the typical rib, it has outer surface. See, outer surface and inner surface. But in first rib, see, this is first rib. This is which surface? Upper surface. And here this smooth is lower surface. Did you see the difference, all of you?
Yes.
Shall I proceed?
Yes, ma'am.
Okay. Now, upper surface. As I said
Ma'am,
earlier,
can you show it again?
rib, first rib, can you see? See?
Yes. Okay.
So this surface, which my finger is pointing, this is upper surface. It is very rough. and it has two grooves. And this surface, yes, this surface is very smooth. This is the lower surface. I wish the day will come soon so that I can teach you face to face. And you can even touch this bone by yourself. See, this is the lower surface. Can you see? Clear? Shall I proceed?
Yes, ma'am. Okay.
Okay. Okay, now here you see in this picture, the upper surface has two shallow grooves. This is the one groove, another groove separated by a ridge and a tubercle. A ridge and a tubercle. The anterior groove, in the anterior groove runs the subclavian vein. In the posterior groove runs the subclavian artery and lower trunk of brachial plexus. This faint ridge and tubercle provide attachment to the muscle, thin layer of muscle of neck. So it is known as ischialinous. Ischialinous means layer. Ischialinous, it lies anteriorly, so the name is ischialinous anterior. This is the key feature of the first rib. Clear? Upper surface clear, all of you?
No, ma'am.
Okay. In the upper surface, there are two grooves. Anterior groove and posterior groove. Separated by this ridge. Faint ridge and a tubercle. The anterior groove, from the anterior groove passes the subclavian vein. Lodges the subclavian vein. Posterior groove lodges the subclavian artery and lower trunk of brachial plexus. Clear?
Yes, ma'am.
The ridge and tubercle between these grooves give attachment to the muscle known as ischialinous anterior. Clear?
Okay, ma'am. Yes, ma'am.
Okay. Now, the area slightly in front of the anterior groove provide attachment to two structures. Slightly in front to the groove for subclavian vein provide attachment to this ligament between the rib and clavicle. What is the name of the ligament? Costoclavicular ligament. More in front to the costoclavicular ligament, the upper surface provide attachment to subclavius muscle. Whereas the area of the upper surface between the groove for subclavian artery and the tubercle of the rib, this area of the upper surface, provide attachment to the muscle ischialinous medius. Ischialinous medius. Okay, I repeat here. In front of the groove for subclavian vein, there is an attachment of ligament. What is the name of the ligament which is attached to upper surface? A ligament between rib and clavicle.
Costoclavicular ligament.
Very good. Slightly in front to that, there is an attachment of a muscle. The name of the muscle is, it lies below the clavicle. What is the name of the muscle? Subclavius. Okay, my dear, very good. Now tell me, my dear student, there is an attachment of a muscle behind the subclavian artery groove. This is the, or posterior groove. Behind the posterior groove here, there is an attachment of one muscle. What is the name of the muscle here?
Ischialinous medius.
Ischialinous medius. The name of the muscle is very easy, no need to mug up here. The muscle which is attached anteriorly is ischialinous medius. In the middle is scalenus medius, behind is scalenus posterior. It's very easy. On the basis of location, the name are given. Okay. Now, the lower surface, there is no picture for lower surface, so you can see. Can you see lower surface? I am showing you lower surface in the video. See? All of you, are you able to see? Please answer.
Yes, ma'am.
This
Yes,
smooth
ma'am.
surface is known as lower surface. And in the typical rib, in the inner surface there is costal groove, yes or no? But in this atypical rib, in this atypical first rib, in this lower surface there is no costal groove. However, there is a neurovascular plane on which the intercostal vessel and nerve lies. The orientation of intercostal vessel and nerve in all other space are band from superior to inferior, but here the orientation are, first there is intercostal nerve, below nerve lies intercostal artery, below artery lies intercostal vein. It is opposite from above downward, from superior to inferior. So this is exception. This can come in MCQ, my dear student. Is it clear? The exception?
Yes.
What is the orientation of neurovascular bundle in intercostal space or costal groove? It is? Are you there, all of you?
Nerve, artery, and from above downwards.
No. In the first intercostal space, it is nerve, artery, and vein from above downward. In remaining space,
Vein,
artery, and nerve. Okay. Now, it has outer border. This is the outer border, which is convex and thick. And just behind the groove for the subclavian artery and lower trunk of the brachial plexus, this outer border provide origin to this muscle. Here you can see in red color, origin to the serratus anterior. First digitation of serratus anterior. Now inner border. This is the inner border. Inner border is thin and concave, and this inner border provide attachment to the fascia or the membrane, which extend from inner border of the first rib to the transverse process of 7th cervical vertebra. The fascia is known as Simpson fascia or suprapleural membrane, which cover the apex of the lung. And this suprapleural membrane or Simpson fascia is also known as cervical diaphragm.
Ma'am, can you repeat?
This is the inner border of the first rib. The inner border of the first rib provide attachment to a fascia, which is also known as suprapleural membrane. What is the name of the fascia? Simpson fascia. This Simpson fascia extend from transverse process of 7th cervical vertebra to the inner border of first rib. It covers the apex of the lung. This Simpson fascia or suprapleural membrane is also known as cervical diaphragm. It is a MCQ question. Clear? What is the name of the structure attached to the inner border of first rib?
Ma'am, Simpson fascia.
What is another name of Simpson fascia?
Cervical.
Yes, cervical diaphragm. Excellent. Or suprapleural membrane. Suprapleural membrane. It separates the neck with the thoracic cavity. It covers the apex of the lung. When we'll teach you lung, no, that time we'll again teach you this fascia. or membrane. Now, site determination. See, are you able to see the first rib? I'm showing. Please say if you are not able to see, I will show you. Are you able to see, all of you?
Yes, ma'am.
Now see here, the larger external end should lie anteriorly. The smaller vertebral end should lie posteriorly. The rough surface with the groove. Here you see the rough surface with the groove. How many groove? 2 groove. Anterior groove and posterior groove with the faint ridge and tubercle should lie superiorly. The smooth surface should lie inferiorly. The concave border should face medially or inward. The convex border should face laterally or outward. This is of which side of first rib? This is of right side. This is of right side. Now another trick I'll give you so that you can remember easily in the exam. So this you should remember. So when you, can you see I have placed the rib in the flat surface in a book. Are you able to see, my dear student? All of you see?
Yes, ma'am. Ma'am, you are muted.
Okay. Now audible? Am I audible?
Yes, ma'am.
Now, so when you put the first rib on the flat surface or any table, what happens? The vertebral end and external end touches the flat surface. And this is how you can see this is on the right side. Now, suppose if I place like this, see here, can you see? In this case, I placed upside down. So in this case, you can see external end is touching the flat surface, but the vertebral end is lifted above, So if wrongly placed, what happened? Then only the anterior end touches the flat surface, the posterior end or the vertebral end will lifted above. So you cannot say this rib is of left side. This is wrong anatomical position. Here you see this is the right side. This is the right anatomical position. See? Okay. So this is a very, very important, most of the time in Viva, most of the time in spotter, OSCE, OSPE, and in gross spotter. The important bone that we ask in exam is first rib. Which rib? First rib. This is the first rib. Okay. Janvi, are you there, Janvi? Janvi? No? Okay. Naveen Bhandari? You will not get attendance, those who are not answering. Yasi Chaurasia? Okay. Rahul Gautam? Okay.
Yes, ma'am.
Okay, Rahul. Which rib is this?
Ma'am, first rib.
First rib. Which part of the first rib is this?
External.
No, this part. See? This part. This. Which part is this?
Vertebral.
Vertebral. What are the
Okay.
part of vertebral end? This is?
Head, neck, and tubercle.
Head, neck, and tubercle. Very good. Very good, Rahul. Saeed Nabil Hassan.
Yes, ma'am.
Saeed, which end of the first rib is this? Saeed Nabil Hassan. Okay. Jaideep.
External.
External end. Very good. External end. Okay. Now, Jaideep, are you there?
Yes, ma'am.
Jaideep, this is the anterior surface of the neck of the first rib. See, I am showing you. Can you enumerate the structure related to this anterior surface of the neck of the first rib in order? There are 4 structures. What are they? From medial to lateral. Okay, Joydeep is confused. Yes, Joydeep? Sympathetic trunk. Okay, I'm not able to hear you. Sudeep Karki, are you there? Sudeep Karki? Sudeep?
Yes, ma'am.
Okay, can you enumerate the structure which is related to this anterior surface? Can you see the rib? I'm showing with the finger, anterior surface of the neck of first rib.
Yes,
Yeah.
I can see.
What are the structures?
It is from mediolaterally sympathetic
Yes.
vein and
Yes.
first posterior intercostal vein,
Yes.
then superior intercostal artery and ventral
Excellent.
ramus of T1 spinal nerve.
Very good. Very good. Okay, thank you very much. Now, Sujata Mahato, are you there? Sujata Mahato?
Yes, ma'am.
Sujata, this is the upper surface, okay? I'm showing you, this is the anterior groove, this is the posterior groove. In the anterior groove, which vessel lodges in the upper surface of first rib? Anterior groove. See, I'm showing with the finger. Sujata.
Ma'am, can you repeat?
This is the, can you able to see, this is the upper surface, okay? This is the anterior groove, this is the posterior groove. In this anterior groove, it lodges one vessel. What is the name of the vessel which lodges in the anterior groove on the upper surface of first rib?
Subclavian vein, ma'am.
Very good. Now, Dheeraj Panjiar. Dheeraj Panjiar, are you there? Dheeraj? Dheeraj?
Yes, ma'am.
In the posterior groove, see, this is the posterior groove. In the upper surface of the first rib, what is the name of the neurovascular bundle lodging in this posterior groove? It lodges 2 structure. Okay? What are the 2?
Plexus.
Yes, lower trunk of brachial plexus, very good, and one vessel. What is the name of the vessel here?
Vessels.
Yes.
Subclavian artery, ma'am.
Subclavian artery, very good. Now, Kaustubh Nepal, are you there, Kaustubh? Okay. Isa Nasim, are you there, Isa Nasim? Isa Nasim? Okay, those who are not answering will not get attendance. Please be attentive in exam. Sorry, class. Isa Nasim. Okay, Shruti Mahapatra. Shruti.
Yes, ma'am.
Shruti, there are two groups. Your friend has answered. One is group for subclavian vein anteriorly here. One is group for subclavian artery and nerve posteriorly here. There is a ridge here in between these two groups. I am showing with the finger. This ridge and this tubercle provide attachment to the one muscle, a thin layer of muscle which lies anteriorly in the neck. What is the name of the muscle which is attached to this ridge and tubercle between the groove?
Ma'am, subclavius muscle.
No. Subclavius lies here, attached here. You are right, subclavius attached to first rib, but not in the ridge. The ridge,
Scalenus,
yes, scalenus anterior. Scalenus anterior. Very good. I appreciate your. Okay, my dear student. We have finished up to the first rib. If there is any queries, please ask. And I have assigned the MCQ. You have to attempt that MCQ in the 2019 anatomy teaching learning teams. It will start in 5 p.m. For 24 hours. You have to attempt that and answer the question to get the attendance. Okay. Before that, last question I want to ask. I'm getting answers, so I'm so much happy. Rashid Tanwar, are you there, Rashid? Rashid. Okay. Siwank Sagar, are you there, Siwank?
Yes, ma'am. Tanvir, ma'am.
Okay, Rashid Tanvir. Which border of first rib is this? This one. It is concave. It is directed inward. Which border is this, Rashid? Okay, Nivea Oswald Vaz. Are you there? Nivea?
Yes, ma'am.
Okay, which border is this, Nivea?
Border, ma'am.
Inner border. Very good, Rashid. Okay. Okay, now Nivea, you tell me what is the structure which is attached to the inner border of the first rib? Here.
Concave.
It is a concave border, you are right. What structure is attached there? A membrane, which is also known as cervical diaphragm.
Yeah, yeah.
Yes, and what is the name now? Tell me, I have given you the hint. It extends up to the
suprapleural membrane.
Suprapleural membrane. Very good. Okay, thank you.
Come on.
Okay, now I'll download the attendance. Okay, if you have any queries, still feel free to ask me in the chat. There is one query, now only I'll answer. One person has asked, what is pleurapophysis? Pleurapophysis means the rib is the extension of the vertebra. During development, the rib is the extension of the transverse process of thoracic vertebra. That is why it is known as pleurapophysis. Clear? Clear? I will also write the answer to that person. So if there is, in addition, if there is any queries, feel free to ask to me in the chat. Okay? Thank you very much. Stay safe.